Thanks for staying with us here on Breakfast Central. Moving now to Zambia. The Health Minister, Masebo, has challenged Zambian medical doctors in the health sector to be exemplary and trendsetters in their profession. Officiating at the 58th Annual General Meeting for Zambia Medical Association, ZMA, Ms. Masebo says over 5 million Zambians are fully vaccinated against COVID-19. According to her, the figure, which translates to slightly over 50% of the eligible population fully vaccinated countrywide, is encouraging.
Ms. Masebo has therefore challenged doctors to look into the welfare, as the rate of mortality among medical doctors was of concern, especially as witnessed during the COVID-19 lockdown. Meanwhile, CMA chairperson Chrispin Moyo has called on the government to create a more enabling environment to support entrepreneurship. Joining us this morning is Zambia Medical Association President Chrispin Moyo. Good morning. Thank you for joining us this morning.
Good morning. It's a pleasure to be here.
All right. Dr. Moyo, the minister made mention of doctors taking drugs to the private sector. Does this mean that Zambian doctors work both in the government and in the private sectors? And is that allowed?
Yeah, so maybe just a little bit of context. The health sector in Zambia and maybe even globally thrives on highly skilled specialists who are in short supply. And as such, any setup will require that some doctors will be employed in the private sector, but they do offer their specialized services in the public sector when they're needed. The same applies to public sector, those specialists who in their free time are allowed actually to work in the private sector. This is with a view to ensure that there's access across the board to the services to our patients. And this is a life-saving. So that is allowed. People can work across. But what we are challenging is that so far we've not heard of any doctor who has been found wanting for taking drugs and other medical supplies from public sector into the private sector. And as you may be aware, we have not had, the supply chain has been disrupted over the last 1 year. There's a shortage of all manner of commodities in the public sector. So I'm wondering what these doctors are actually stealing, because the supplies are actually dire in the public sector. So if we stretch it, we would actually challenge the government, the minister. If there's anyone who is found stealing drugs, let them be prosecuted. Because even as a profession, we don't know people who are dipping into public resources for private.
Well, can you share a little bit more? Because members of the association have complained about the challenges that they're facing in service delivery, which include, of course, availability of supplies and some other, things that have been mentioned. Is there a possibility that this, any of this might be resolved soon?
So the supply of commodities has been a big challenge. We were promised that this is going to be resolved soon by way of restructuring the procurement through the agency that has been created as the procurement agency for the Ministry of Health. But up to now, I think there's still reorganization that is going on. But our patients will not wait. Our services will need to continue to be given, even while that restructuring is going on. So it has taken rather long. It's almost a year since we had the sustainable supply of commodities in the public sector. And we feel that this has to be given utmost attention by the minister and the ministry responsible for procurement.
Okay, let's talk about your department. How would you rate your department's performance in the new dawn government?
Yeah, so the performance really has been, we would say that the government has shown a lot of commitment to do things differently and maybe upscale some of the things that were done in the past. we have seen a recruitment of 11,200 healthcare workers, which has materialized, and these people will be joining the public sector in the next few weeks. They are now being sent to where they have been employed. We've also seen a commitment in terms of budgetary allocation. There's an increase in the budget allocated to health, but this has to translate into savings. And herein lies our challenge to government, that it's one thing to say we've increased the budget. It's another thing also to say that we've employed staff. They need to be incentivized, they need to be equipped, and they also we need to make sure that the environment in which they work is conducive and is safe.
Thank you, Dr. Chrispin Moyo, for joining us this morning. We hope that all that you've expected, you stated as your expectations, are being met in this regard.
Thank you. It was a pleasure.